students. Good afternoon to all of you. Now today I am presenting low intensity shock wave therapy, how good it is for severe unresponsive erectile dysfunction which is resistant to the PDE5 drugs. Now we have done this study in two of our institutes in Hyderabad, and we have acquired this machine almost 8 years back. We know that the shock wave therapy is used for kidney stones since 1977, when German urologist Christian Chaussy has actually first fragmented a stone to the path-making discovery to know the strength of the shock waves. They are also used in orthopedics, cardiology, for wound healing, plastic surgery, and neurourology also. Now this has got intense strength and intensity, like a supersonic plane, the lightning, thunder, all are examples of a shock wave therapy. It was a Dornier aircraft was actually dented when it went up to the clouds, when the water droplets have hit it with such an intensity. Then it was thought that if we can actually control the shock waves and focus them onto the desired object, then we can actually pulverize the stones. How do they act? Is high voltage creates an electric spark discharge and water vaporizes, creating an explosion, and then these shock waves are reflected by semi-ellipsoid. As we all know, it was actually water medium through which the extracorporeal shock wave therapy for kidney stones is done. Now, as it is focused, it can be used in orthopedics, for cardiology, for patients where CABG has failed or recurrence of disease in cardiac patients. For the ED, it was used since 2014. The difference between a shock wave therapy for a kidney stone and the erectile dysfunction is in the focal length. For ESWL, for kidney stones, it is quite longer, whereas the organ is small, it could be held with the hand, and the focal point is much lesser, and we could focus it whichever point you want as you do the shock wave therapy. We have a pointer here. If you see here, the shock wave therapy extends for almost 9 weeks. The first 3 weeks we give six shock sections weekly twice. Week 1, week 2, and week 3. Then we give 3 weeks rest. And the second sitting, week 7, week 8, and week 9, 2 sittings each. Totally 12 treatment sections are given, and each treatment it actually lasts for around 15 minutes. We focus on the 5 parts. The most important is crus portion, where the cavernous artery starts, and then as we come on to the shaft, we depending on the size of the or length of the penile organ, it could be 2 parts or 3 parts. Now, what does it do? The shock wave, how does it help in a patient with erectile dysfunction? It creates shear stress and intercellular and extracellular responses, stimulates nitric oxide synthase, and release the vascular growth endothelial factors and BCNA, proliferating cell antigens. All these cause neovascularization, and the same modality is used in different places like cardiac revascularization. The low intensity shock wave therapy, especially designed for erectile dysfunction in patients whom there was no response with PDE5 drugs. Most of the patients are taking over the counter without proper prescription and using the dosage, a ceiling effect, and sometimes going more than 100 mg or 200 mg of sildenafil citrate, which cause side effects but not a beneficial effect. So 3-minute application with 300 shock waves in 5 different areas is what we do. It's painless. It could be easily tolerated by the patient. It doesn't need any anesthesia, and most patients they can easily. Well, initially they are a little worried because the term shock wave itself frightens a person. But it's not shock wave. It looks like a vibration or a soft bombardment, which is easily tolerated by the corpus cavernosum. Where are we focusing? Is for the cavernous artery, the diameter itself, the lumen itself, where microleaks or microcalcifications cause the lumen to be decreased. If you see here, this is a video which shows how we are focusing first on the crus and then going on to the shaft all along the line. And if you find any calcific deposit or a calcium plaque like a peroneal block also, we can bombard them little longer. By this procedure, what it does is it actually diameter is doubled, the neovascularization occurs, and see the blood flow also is significantly increased. So when this happens, the erection is very good even in patients where there is no response with PDE5 inhibitors at all. You can see here 18,000 shocks are given in a period of 9 weeks, and we had 472 patients who have undergone this therapy, median age was 62 years and majority were little higher than 45 years. And the cardiovascular disease were in 68 patients and diabetes was in 144. And primary measures were erectile dysfunction criteria. You can see here, we have internal index of erectile dysfunction. Normally it should be around 25 or above. For our patient, it was between 11 to 15. And what happened after treatment is, we have seen the penile Doppler as a parameter which improves the blood flow. You can see initially there were blocks and constrictions which were actually recovered, and the Doppler also shows increased diameter. And IID domain score has improved almost by around 15%. 368 of 472 subjects, almost 78% of patients improved from erectile dysfunction, almost from less than 2 to 3 in erection hardness score. So this study emphasizes the feasibility and tolerability of penile low intensity shockwave therapy in vasogenic ED patients. No reported side effects, and it shows significant improvement in patients with erectile dysfunction remaining at least for 6 months. And erectile dysfunction shockwave therapy can be used effectively in patients of ED patients. And further study is necessary to evaluate the methodology for patients in Peyronie disease also. We also done in some patients, but Peyronie disease is not a good number, that's why we are not presenting. This is only for severe erectile dysfunction patients who actually suffered and didn't have any response with highest doses of PDE5 drugs. Thank you.
What is the cost for the treatment? Treatment cost.
What is the cost of it? Generally, we charge 5,000 for each sitting, sir. So initially we were charging every session, but patient used to drop out. So we used to say 30,000. If you pay, we start the treatment, because patient should have some response. If you drop, sir, in between, the machine is in disrepute. Patient interprets as if there is no response. It was not a useful machine. So most centers, they collect minimum 6 sittings amount, so that patient comes for those 6 sittings and then slowly finds the benefit. And if he is interested, he can come back for next 6 sittings after 3 week gap. Surprisingly, a patient who has done for 6 sittings comes back and he finds the benefit. A patient who has gone after second or third sitting, he is confused and we could not trace him. And that sort of patients are more than 1,000. So I have presented 468 patients only, but majority of them initially, without our experience, we were saying, come and pay each time, means they drop out. They are actually not having enough knowledge that if you do for 6 sittings, certainly there will be neovascularization, for which they are not very keen to wait that long. They are simply saying after first sitting there is no response, so they thought it is useless.
Now, how long this response lasts? You said 6 months, isn't it?
No, sir. No. We actually take the patient who had severe ED for more than 6 months duration. The response after this treatment is 8 years minimum and up to 12 years. So I said we have acquired this patient 8 years back, and most of patients whom we have done initial study have not come back. Even if they come back, they came for some other problem and they didn't comment about it. They said it's okay. So international experience says that maybe after 12 years also it works, but our follow-up is only for 8 years. And once the neovascularization occurs, the lifestyle changes have occurred, and the patient knows how to not to gain weight and how sugar can be controlled. All these things happen. Then maybe 15 to 16 years also the beneficial effect may be there.
So the long term it will be around 10 years.
Yes, 8 to 10 years you can say, sir. Yes, yes.
How often do you repeat the thing, or is it only one set?
No, initially I told 6 sittings in first 3 weeks. Give a gap of 3 weeks, and then do another 6 sittings in 3 weeks. So totally in 9 weeks the treatment is over. I need not come for any further sittings. And some patients at the end of 8 years have come and said, sir, we keep for 2 or 3 sittings. We enjoy the benefit in more when you give the sittings. Such patients you have done, but that's not the routine. Most patients are happy, and this why it happens is the microcalcification in the arteries disappears. This has accumulated over a period of 10 to 15 years. At the age of 45, maybe he had microcalcification from 30 years. So those 15 years of calcification are removed. So maybe it takes another 15 years for the calcification to form again, and might be they could come to us if necessary after 15 years, not before that.
One question, sir.
Yeah.
What was the preoperative criteria to choose for this therapy? Do you have any side effect criteria?
Yes, sir. There are 2 things I have shown. One is internal index of erectile function, ED domain score, less than 12.
No, because
Less than 12.
it only affects the vascular
Yes,
part.
yes.
So is there any criteria? Do you have preoperative Doppler?
Yeah.
And,
We have done the penile Doppler. I have shown one the previous slide. The penile Doppler is the only study where we have done to establish that the flow is very less. The peak
So
flow is
do
very
you
less.
choose the patients based on the period Doppler?
Yes, yes, sir. And
That
we
was
rule out
not
all the
mentioned.
neurological patients, neurological, psychological, and injury patients. Yeah.
Can you take diabetic patients also?
Yeah, I've shown that there are 144 patients out of about 468 patients. Majority of these patients of vascular erectile dysfunction have vascular vein problem. Majority have, and the cause of blocks in these patients is microcalcification, atherosclerosis formation. We are breaking the atherosclerotic plaques, which are visible or invisible, but microcalcification also is there, which makes the arteries inelastic, leading to decreased flow despite the good urge.
One is the microcalcifications are broken, but your theory is that it induces vasculogenic growth
Yes.
factors, which is the most important thing.
Both are important, sir. Microcalcification is very
Does it have, there is no long-term follow-up, any spongiofibrosis or something like that has happened?
after 12 years, sir.
Yeah.
After 12 years, we don't have only 8 years follow-up. Only two things, sir. One is VEGF, vascular endothelial growth factor, and a BCNA, proliferating cell nuclear antigen. So these two are elevated in the blood in these patients, and that leads to neovascularization.
Okay, sir, thank you.